So, can you see my slides? So, here are my topics. Here to aid dementia and hearing loss. Sorry. Ah, wait for a few moments. Sorry for that. Okay. So, here to aid dementia and hearing loss. So here are my objectives. Number one, to educate our viewers regarding dementia, the risk factors of having dementia, the effect of hearing loss in patients with dementia, and somehow I'll touch on the non-pharmacological interventions on taking care of patients with dementia. Did you know that dementia is one of the major causes of disability and dependency among older people? Unfortunately, 2 out of 3 people has little or no understanding about dementia. And it is projected in 2050 that at least 131.5 million people will be living with dementia. And this will be seen at least 68% in low and middle income countries, including our country, Philippines. And unfortunately, every 3 seconds while I talk, someone in the world already develops dementia. So what really is dementia? Dementia is a syndrome in which there is deterioration in memory, thinking, orientation, comprehension, language, learning capacity, and judgment. And we have what we call as ABCs of dementia, meaning there will be an effect on the following. A, for activities of daily living. B, behavior. And C, cognition. Usually, we are only focused with cognition, cognitive impairment of our patient. But in reality, the patients already have problem with activities of daily living. What are these? The basic ones: toileting, bathing, eating, dressing, and even grooming. Usually, this will be seen at middle or late stage of dementia. Next, there are also problems with paying bills, banking, finance. Some of my patients won't be able to cook their favorite food. Some would have difficulty in shopping or marketing, and some will have difficulty in running or doing their own professions. Behavior and cognition, at least minimum of the two of the following. They have difficulty in acquiring and remembering new information, difficulty in reasoning and handling complex tasks, visual spatial abilities, they have difficulty in language, and for some, they have changes in personality or behavior. They become aggressive or have paranoia. Here are the stages of dementia. For early stage, it's seemingly like a normal aging. Problems coming up with the right word, remembering names of new people introduced to them, of course, losing or misplacing objects. As the dementia becomes severe for the middle stage, even their own personal history, what's their telephone number, their address, the college wherein they went to or they graduated to, and at times during parties or social gatherings, they would be withdrawn or even moody. And for later stage, unfortunately, they become disoriented to time, place, and even to people around them, including relatives and friends. And as I've said, even activities of daily living, they have difficulty in self-care already. And some, they will have behavioral changes and including aggression. So is dementia part of normal aging? Actually, that's fake news. Dementia is not part of normal aging. Usually, it is overlooked and mistaken as normal part of aging, just forgetting some facts. However, this is a healthy brain. Everyone, including me at age of 60 years old, will have physiologic aging of the brain. Somehow it will get atrophied a little bit. However, for advanced Alzheimer's disease, as you can see, there will be shrinkage, okay? Shrinkage of your brain. It will be compared to a healthy grapes versus raisins. So for advanced Alzheimer's disease, their brain seems to be like raisins, shriveled. So what's the difference between normal aging and dementia? Both can be slow in memory. However, for patients with dementia, they have inaccurate recall. They need help to find objects, lost objects. Even with cues, they will have reminders failing. They cannot follow directions, especially verbal directions. Again, they would have unable to take care of themselves, and unfortunately, it progressively declines. Is dementia the same with Alzheimer's disease? Another fake news. Actually, Alzheimer is highlighted in three words: chronic, meaning very long time; progressive, it worsens; and irreversible. It cannot be changed or shift back already. So what's the difference, doctor? Dementia is actually a bigger picture. It's a bigger umbrella. Alzheimer is just part of dementia. At least 80 to 90% of those who have dementia could be Alzheimer's. Some will be due to stroke, vascular dementia, and some due to infection, metabolic problems like lower sodium or lower salt in your body, or even high or low sugar levels could also cause temporary dementia. So again, dementia is a bigger umbrella, and part of it is Alzheimer's. And what are the risks of having dementia? Early in life, at least less than 45 years old, less education will already have a relative risk of increasing dementia. It is proven that at least 10 to 15 years of having a good education will lower your risk of having dementia. And for those midlife or 45 to 65 years of age, hearing loss, traumatic brain injury, and those other modifiable risk factors such as hypertension, alcohol, obesity will cause relative risk factors. Same with more than 65 years old, smoking, depression, social isolation, physical inactivity, diabetes, or even air pollution. Very important here, 8%, 8.2% will have a risk factor of having dementia when you have a hearing loss at age 45 to 65 years old. So what's the relationship between the two? Actually, there's a big relationship between the two. So from the sound collection, it goes into the ear, and then there will be a middle ear to inner ear conductive mechanism, meaning there will be conversion of the stimulus from the sound to data into our brain. Our brain's like CPU, it's storage. And then both ears will have stimulation on both temporal lobes or the auditory pathways. Remember, temporal lobe is one of the locations for memory or the hippocampus area. So stimulation, increase in stimulation will also produce increase in memory or increase in data within our brain. But if there's hearing loss, there will be low input in our brain. Remember earlier, I've shown you Alzheimer's brain, advanced Alzheimer's brain like racines. Look at the one with brain with hearing loss. It's also shriveled, shrinked, small, atrophied, almost the same with advanced Alzheimer's disease. And as you can see, hearing loss, decreased auditory input, meaning decreased stimulus, there would be decreased nerve activity, there will be structural changes in your brain, so your brain will be atrophied or become small. There will be cognitive impairment. So very important, hearing loss. And as you can see on my table right now, dementia and untreated hearing loss is almost the same. They will have social isolation. You cannot hear anything, you will be isolated. You don't know anything or your memory is lost, you will have also social isolation. Decrease in comprehension. They keep on repeating questions like patients with dementia. They would have memory problem, inappropriate words, and difficulty in following conversations. And unfortunately, because of these effects of hearing loss, there will be psychological aspect in having dementia or in patients having dementia. How? Communication difficulties, and because of that, they will have social withdrawal. They would have increased task difficulty, memory problems definitely, and because of the isolation, they would have poorer well-being, hallucinations and disorientations, and unfortunately, this will increase burden on family and friends. So as I've said earlier, hearing loss can cause cognitive impairment. Unfortunately, isolation, verbalization, poor verbalization, decreased socialization can cause depression, anxiety, and social isolation. And again, cognitive impairment. If you can remember earlier, for more than 65 years old, depression, social isolation, withdrawal can also increase the risk of having dementia. So how do we do that? How can we reduce our risk of having dementia? Everyone was done uniquely or made uniquely. So focus on individualized care. Each individual is unique. Each elderly is unique. Okay? So what do we do? Exercises for elderly. Okay? These exercises together with other elderlies can increase the dopamine and serotonin of our patient, will improve their well-being and perspective. Get rest. Most of our patients with who are elder will have difficulty in resting or even in sleeping. Good rest can increase or can improve our neurons. And with improved neurons, there will be better wiring of our brains. Of course, friendship, building relationship, it's very important. Some trivia, at least 10 minutes of socializing a day can increase or improve cognitive performance. So it's very important that our elderly will have socializations. As I've said earlier, hearing loss is very important. It increases the risk at least 8.2% of having dementia. So monitor your hearing as early as 45 years old, at least 45 to 65 years old, because it decreases the risk of at least 8.2% of having the risk of having dementia. And if you have time, get Zen. Meditating for at least half an hour for 8 weeks will be shown to grow great matter in the hippocampus, which may improve memory and learning. So the more rested you are, less stress, less problems, you will be able to improve more your neural connections of the brain. And how about those who care with or whom we have patients who have dementia already? There are some interventions, definitely pharmacological, but these are some non-pharmacological interventions. Number one, improve memory using different strategies. How? Association, mnemonics. If possible, have multiple choice cues. Also, have some family pictures within. Use name tags, especially for the late stage dementia. Use name tags. Simple list of things. What do you do? What do you need to do? Just simple things. Of course, label the medicine and pill boxes because some of the patients will continue to drink medicine, unfortunately, and some will have an overdose. And please avoid moving things around. I know there are times that we want to have new environment, no? But for patients with dementia, they wanted simple environment in which they would be able to remember the things exactly as what their mind is telling them. Improving communication, you need to maintain eye contact. Speak slowly and in a soothing voice. If you can, sentences are more shorter or more short. Use hand gestures. For example, you need to put it up, so you give hand gestures. Use physical prompts. What do you want to do, mommy? Or what do you want to do, daddy? And then use the power of touch. Okay, but because some of the patients will really have some aggressive behaviors. Lastly, you must maintain people's awareness. How? Give calendars. Okay, keep track of the time. As much as possible, they have their own clocks. No, if you could give the digital, better. And then if you have also curtains, please open. For example, it's dark, open the light. If it's night, tell them it's already night. Okay, this will help our patients with dementia to have awareness of their environment. So I think that will be my last slide. For patients who have dementia, it's difficult. What more if they also have difficulty in hearing? So again, thank you for listening.
Thank you, Dr. Donna. It's a great pleasure to have you here with us and share your knowledge to our live audience about our topic tonight. I'm also looking forward to the questions our live viewers will ask later. You know what, Dr. Donna, I agree with you. Unaddressed hearing loss impacts many aspects of an individual's quality of life. In elderly, one of the classic signs of hearing loss is having difficulty understanding conversations in a social gathering. We often ask others to speak slowly and clearly, or ask others to speak louder or repeat what they said, making their brain work harder by forcing it to strain to hear the conversations at the expense of other cognitive processes such as working memory. Thus, hearing loss leads elderly to have difficulty in maintaining interpersonal relationships, which is actually very important to remaining intellectually stimulated. Several journals reports mention that untreated hearing loss in older adults can lead to social isolation, depression, inability to work, and even reduce physical activity. And like what you mentioned, according to the 2020 Lancet Commission on Dementia Prevention, adults with hearing loss have a greater chance of developing dementia. It also lists hearing loss as one of the top modifiable risk factors for dementia, which also includes excessive alcohol consumption, exposure to air pollution, and the cardiovascular risk factors like hypertension, diabetes, obesity, and smoking, all of which have been shown to increase one's risk of developing dementia. It was also mentioned in the Lancet Commission on Dementia Prevention that about 40% of dementia cases could be prevented or delayed by targeting the 12 potentially modifiable risk factors. The report it laid out a set of policies and encouraged lifestyle changes to help address the problem. So, to our viewers, I'll say prevention and early detection of hearing loss is very important. If you have any signs and symptoms, or if you are at risk of hearing loss, such as having a family history of hearing loss, if you work in a noisy environment, if you take certain medications like antibiotics, cancer treatment drugs, or you're taking too many pain relievers, then get your hearing tested by a qualified healthcare provider during your regular checkups. Okay, to our viewers, feel free to send your questions via our comment section, and our team will flash it on the screen later during the question and answer session. Our guest speakers will answer those personally. So after Dr. Donna, we also invited another amazing guest speaker for tonight. She is an international audiologist who is also a part of one of the top global brands that offers innovative hearing aid technology and prominently known in providing its users with high-performance premium hearing aid products, Oticon from Copenhagen, Denmark. Specifically, she is an Oticon expert trainer in audiology and hearing aids in Latin American countries since 2010 until present. Her impressive educational attainment revolved around audiology, and with her 20 years of clinical experience, she established her expertise in customer care, hearing aid sales and training, audiological diagnostic testing, and hearing aid fitting process. Let us all welcome our second and last speaker for this live episode, Ms. Linda Florian from Oticon. Hi, Linda.
Hello, Dr. Joel. Thank you for that wonderful introduction. Before to start my presentation, I would like first to apologize for my voice. I have a small allergy, but don't worry, I have voice for speak. And also, I would like also to thank to Manila Hearing Aid for inviting me to take part in their Hearing Aid 2 series to share my knowledge and experience for tonight's event. I also want to thank you to our Filipinos viewers for joining this live event. Tonight, I will talk about brain hearing, and I will talk how we can help with our hearing aids keep our brain fit. So just let me share my screen. Just 1 second, please. Okay, can you see it? Okay, I think that you can see my screen. Okay, great. Okay, did you know that the hearing aid can help to keep our brain fit? That's why this is the reason for Oticon brain hearing technology. Just 1 second. So, as Dr. Adona said just before, we here with our brain. We need our brain for to hear in a correct way. It is very important for us to that our brain receive the sound in a better way. The brain needs all sounds in order to work in a natural way. That's why we always try to imagine, as a hearing aid company, how we can help the brain in order to introduce a good technology for doing the process in a right way. I would like to show you that picture. And I would like to show this picture because this is a normal activity. You can see that guy. That guy is in a familiar dinner. Maybe that guy is your father, your grandfather, and he would like to participate in that familiar event. But the problem is that this guy cannot hear them. This guy tried to understand me, but it's impossible for him try to follow the conversations. So maybe the rest of the family are happy because they are together, but for him, he's doing a big effort for try to understand them. So maybe at the end of the activity, he will go to his room, he will feel sad because he couldn't communicate with his family. He couldn't follow the conversation. He couldn't identify where is the voice that he trying to hear. So it was a big job for him. He feels tired, but he couldn't understand anything. This is the reality for many people with hearing loss. When we have a hearing loss, the problem that we have with this is because the brain doesn't have the correct sounds. The brain doesn't have the full sound sinks in order to make the process in a correct way. When we think about the hearing, we know that our ears receive the full soundscape, the full sound sinks from the environment, and our ears are like a windows. So they receive the sound and then send through the auditory nerve the signal to the brain. When the information is complete, the brain can do the process in a very good way, as we do normally. The brain can orient, the brain can identify the sounds, the brain can recognize the sounds, and at the end can produce an answer. And if the brain receives the sounds, after this, the brain can focus in something in special. So this is the way that we communicate normally. Normally, our brain receives the information to start to think about the information, to recognize the sound, and then produce because he's focusing in something in special. But when we have a hearing loss, there is a relationship between a hearing loss and cognitive decline. Because the brain is overworking all the time, trying to identify the sound, trying to identify the words, the different sounds. So for the brain is too much work. With this, when we have this reality, the brain increase the listening effort, increase the cognitive load, reorganize the brain structures in order to try to get more resources for try to identify the sounds and accelerate the cognitive decline at the end because the brain is tired. The brain is tired, overworking the whole day for many years. And with this also, as the Dr. Donna also mentioned, there is a lot of social isolation for the patients because if the person cannot recognize the sound, cannot communicate in a good way, they prefer to live alone in a separate way. So we can say that a brain problem turned into life problems. When we have hearing loss, there is a direct relationship between how can is our hearing loss in comparison with the dementia. If we have a mild hearing loss, we have the risk of dementia maybe 200%. But if we have a moderate hearing loss, we have a 300%, or if we have a severe hearing loss, we have a 500% of risk to having dementia. So the problem with this, if the person don't want to do anything about to treat the hearing loss, this brain will be tired. This brain will work in a bad way. So that's why the hearing loss is so important. It's so important for the brain and the brain to work in a good way. The magazine, the Lancet magazine, in 2017, produced a very nice study, and also Dr. Donald mentioned this, that that study mentioned that there is a very big percent, in my case, 9% of the risk to having a dementia if we have a hearing loss. There are many other risks for having a dementia, but at least with a hearing loss, we have 9% in order to increase our risk to having dementia. When we have the risk for having a dementia, we have two different factors. We have a modifiable factors, and we have a non-modifiable factors. When we have a non-modified factors, okay, there is nothing that I can do for this. But with the modified factors, I can do something. And with the hearing loss, at least I have a 9% of risk to reduce this risk if I do something. So with this study, we realized how important is the impact of the hearing loss in the dementia disease. And also how important is the hearing loss in to keep our brain fit. It's not only Alzheimer or dementia disease, it's also to interact in our social activities. It's also to get a better communication with our family, with our colleagues, with our friends, because all those factors are impacted directly when we have a hearing loss, and I don't do anything about that. So maintain your brain with hearing aids. This is very important. When we have a hearing loss, we need to realize that we need a hearing aids. There are many studies that show that people with hearing loss can reduce the risk factor for having a dementia. Also, there are many studies that show that the people who use hearing aids experience a cognitive decline at the same rate that people without hearing loss. It means that if I use a hearing aid, I reduce the factor to having a dementia or Alzheimer's disease, and I will have the same aging of my brain that the people without hearing loss. So this is very, very important. It's not like I will keep my brain as a younger person, not. I will keep my brain as a normal person with a normal age. This is the message. So if I maintain my hearing aids, my brain will appreciate this in order to decrease the risk for having a dementia. For that reason, we start to study how our brain needs to receive the sounds. And that's why we realize that our brain needs all sound scenes in order to work in a better way. When our brain receives the sounds, the full sound scenes, the brain can work in a natural way. The brain doesn't make an additional effort. And with this, the brain will have more energy for other activities, for other things to do. That's why with our latest hearing aids, we introduce this full perspective. Our latest hearing aid is Oticon More, and it's the first hearing aid that can provide the full perspective of the sound in order to give the brain the correct sound, the correct way to listen, and to make it easier for the brain. With this, we believe that our perspective with Oticon brain hearing technology, we change the brain because we make it easier for it, and also we change the lives. Because when we provide a full sound since our break, we receive a very nice sound and we work in a natural way. This is a big comparison because when we make the comparison with the old perspective of the technology in the hearing aids, the conventional technology suppresses many sound scenes, and also when there is a directionality or there is a not complete information, the ear will not receive a complete information and the brain will receive just a part of the information. With this, the brain cannot work in a good way because the brain always will receive a very small information to do its process, so it cannot do in a natural way. But with a good perspective, with a good full sound scenes, the brain will receive a complete information. The brain will work in a natural way, in a normal way, in an easier way. So that's with this, the effort that the brain makes is so much less than with a conventional perception. So with this new perspective, when we send the brain the full sound scenes, the brain naturally can orient the sounds, can focus the sounds, can recognize the sounds, can communicate in a better way, can reproduce a better answer because it is receiving a very good sound. With this technology, we can enjoy different environments. Imagine that picture. This is maybe a picture with so many sounds. Maybe we never be in our life in a reality like this. But the message here is, if the brain works in a good way, if the brain receives the information from the ears in a good way, the brain can work even in an environment like this. So with our hearing aids, Oticon More, we are available for producing the best way sounds to the brain. And with this, the person can enjoy an environment like this. The person will be available for listening everything, but maintaining the speech, the conversation, on the focus, on the want-to, in a higher level. So he can be part again of the life. He can enjoy the different activities that he wants to do. We are providing the optimal conditions for the brain to perform in a better way, because we make a contrast with the different sounds around him. We make a balance with the all sounds around him. So the brain can orient in a very natural way, can recognize the sounds, and can focus in a very easy way. With this, we reduce the effort of the brain, we reduce the cognitive load, and of course, the person at the end of the day will have more energy for participating in different activities. A part of this, we have a new evidence that show, as I told you before, that if the brain receives the sounds in a good way, the brain can understand more with less effort. And this is very important with the patients with hearing loss, because if the patient with hearing loss can understand much better with less effort, can participate in a better way in a communication, as I showed you before. With the Oticon technology, with more hearing aids, we could increase 30% the more sounds to the brain in order to give more opportunities to the brain to orient in a natural way and focusing in the sound that they want to. So with this, we can see a comparison. If we have an ultrasound hearing loss, of course, for the brain, we will have a less stimulation. We accelerate the mental decline, and we have a big risk to having dementia. So with this, we have a trouble for socializing, for doing different activities. But if we have a trained hearing loss, we can improve many communication skills. We can be part again of social activities. We can keep our brain fit, only if we just pay attention in our hearing loss and doing something about that. So for summarizing, we can say that a hearing problem can lead into a brain problems. And with this can turn into a life problem, because having a dementia, as Dr. Donna just mentioned, is a big problem for the life. The brain needs access to the full sound scenes in order to work in a natural way, in order to work the job for it needs to do. So if we make a correct feeling process, if we make a good feeling process, if we make a good training in the hearing loss, we will reduce all those impacts and our brain will be more healthy, at least with respect to the hearing loss. We cannot do anything for the other risk, for the other factors, but at least if we try to keep under control the hearing loss, our brain will appreciate this. So thank you very much. I think that for me, it's enough for now.
Thank you, Ms. Linda. Manila Hearing Aid is also grateful to be our guest speaker tonight. Well, based on several cross-sectional studies, there is an overwhelming consensus that hearing loss is a risk factor for dementia. And there are several ongoing prospective studies aiming to a better understanding of the etiology behind connection between hearing loss and dementia, which in turn will help lead to interventions that preserve cognitive function in patients with hearing loss. Again, according to the Lancet Commission on Dementia Prevention, hearing loss is considered the number one modifiable risk factor. The long follow-up times in the prospective studies in the report suggest that hearing aid use is the largest factor and protective from cognitive decline. Therefore, addressing hearing loss may be more effective in reducing the risk of dementia than any other modifiable risk factors. As explained in your presentation, Linda, amplification by hearing aid decreases the stress on the brain. It decreases the cognitive load, which in turn decreases the need to divert cognitive functions to auditory processing at the expense of other processes like memory. Therefore, the better the hearing aid technology, the clearer the sounds that reaches the brain. And this makes it easier for patients with hearing loss to understand and remember what others say. Ms. Linda mentioned also that for many years, Oticon has carried out pioneering research on how hearing loss affects the brain and is dedicated to innovating hearing aid technology. Oticon's brain hearing philosophy enables patients to enjoy more, to take part in social engagements, and to hear life's special moments. So I will mention it again that early intervention is the key in delaying cognitive decline. The better the person hears with quality hearing aid technology, the more it helps keep the brain fit and healthy. Okay, we will now proceed to our live question and answer session with our guest speakers. To guide our speakers, our team will flash the questions on our screens. Now I will read it one by one and hear your thoughts about it. Just to keep you both guided, there will be questions for Dr. Donna and there will be ones for Miss Linda, based on the topics each of you discussed. Okay. Can everybody read the questions? Dr. Donna and Dr. Linda, can you? Okay,
Yes,
I'll
Dr.
read. Yeah, I'll read the
Yes.
question. So, is brain hearing exclusive to Oticon only? Miss Linda.
Yes, I think that this question is for me. We started with this philosophy for so many years ago. I can tell you that we're studying this for more than 25 years. So we started to develop technology like 10 years ago from here. So this is our concept. This is an Oticon concept. I can tell you that maybe other companies can mention something similar, but brain hearing concept is an Oticon concept.
Okay, thank you, Linda. So for our second question, okay, so can you please post the question here? Okay, so I'll read the question through my phone. Okay, good evening. Just wanted to ask, is dementia hereditary? If my grandparents have such cognitive issues, does that mean all of us will have that in our family, or can we manage that? I think that question is addressed to you, Dr. Donna.
Where is it? Okay. Yes, there's some part of it, especially pure Alzheimer's disease. It is at least, I think, 70 to 80% it's genetic. Okay, at least every generation will have a problem with cognitive impairment. So it is hereditary. Yes, it is hereditary. Usually it will be seen, unfortunately, at least younger age, 50 or even before 60 years old. Some of the patient will already have manifestation of dementia. Can we do something about it? Actually, that's one of the things most neurologists, or I mean dementiologists, they call them the one expert in dementia. They keep on reading or they keep on researching on how can they prevent dementia by having, for example, earlier diagnostic test. But unfortunately, until now, the only way that we could do that is one, I think we have talked about it, me and Miss Linda, decrease the risk factors of having dementia. Number two, if you have already problems, kindly consult your neurologist so that they could have a panel of exams for you and we could guide you through it. But other than that, can we prevent it? Until now, except for the risk factor, the modifiable risk factors, that's the only thing that we could help to prevent patients having to have dementia.
Yes, thank you, Doctor. Because yeah, you mentioned there are 12 modifiable risk factors, and one of the risk factors is hearing loss. So hearing loss can be addressed. I mean, we all have basic screening tests and hearing tests, like when you're above 40. So like what I said also, when you have hearing loss, or if it runs in the family, hearing loss, then might as well have the screening test for that, or have the test included in the regular checkups. Okay, so for the next question, can you please post it here in there? Not that one I can read.
Okay.
So the next question: can I acquire dementia at a very young age? Let's say in my 20s. Okay,
Okay.
Maradona.
I think that's for me again. So I think acquiring dementia for a very young age. I told you earlier, dementia is an umbrella. Okay, you have a lot of reason why are you having dementia. One only is Alzheimer's. Agree. Actually, in 20s, yes, if, for example, you have viral encephalitis, you have problem infection, CNS infection, or central nervous system infection, you have metabolic problems, probably, yes, you can have dementia at very young age. But most of them, especially for younger individuals, it is reversible. Okay, once you correct the infection, you corrected the infection, you corrected the metabolic problems. For example, sodium problem, your salt intake, too low salt intake. For example, if you have diabetes, especially type 1 diabetes for younger people who have diabetes, and you will have hypo or hyperglycemia, there could be a acquired dementia, a temporary dementia. But as long as you're able to control all these things as soon as possible, it could be reversed. Okay. Did I answer your question?
Okay, thank you, Doctora. Okay, so for our fourth question, is it true that if you have hearing loss, you have a greater chance of developing dementia? I think Miss Linda can answer this question.
Yes, at least I can tell you that you have between 8 or 9% to having a dementia if you don't do anything about the hearing loss. So as Dr. Adona mentioned, and also I mentioned in my presentation, it's a modifiable risk. So if you can make a right treatment of this, you can reduce in 8 or 9% the factor for having a dementia.
Okay, thank you, Linda. Let's wait for the next question. Okay. Okay. Linda, Miss Linda and Dr. Donna, I'll just read the question on my phone. But can you read the questions here? Okay.
Yes.
Okay. Okay. So, the question goes like, my lolo has hearing loss, yet we know we don't have history of dementia. He is already wearing hearing aids for 2 years now. Is it still possible for him to acquire dementia even if his hearing loss is managed? Um, I know. I'll ask first Dr. Donna, and then I'll get your comments also, Miss Linda.
Okay. Like what we have told you, usually for dementia, it's not only hearing loss. That's the problem. There are other risk factors of one having dementia. So for your grandfather, Lolo, for Miss Linda, for your grandfather, very good that he already have controlled hearing or the hearing loss problem because it decreases the risk of having dementia. But if your grandfather, for example, has hypertension, traumatic brain injuries, obesity, or even psychological problems, unfortunately, they can still have dementia. We still have what we call as vascular dementia due to stroke. But again, because it decreased by wearing hearing aids for at least 2 years, at least it decreases 8 to 9% of relative risk factor of one having dementia.
Miss Linda, how about your take on your comments regarding the question?
Yeah. Yes, I can tell you that at least your Lolo is a nice word. Your Lolo did the thing that he did to do with a hearing loss. I mean, now he's working in his hearing loss with the hearing aid, so that's perfect. As Dr. Adona said, he has other factors, okay. But at least with the factor of the hearing loss, he already do something. I mean, he already did something about the hearing aid, about the hearing loss with the hearing aids. So it's fine. I mean, at least with this factor, he's okay. Yeah.
Okay, thank you, Linda. So for our next question, okay, sorry. The question goes after surviving after surviving meningitis at age. Wait, sorry. Kindly, can you please allow the tech team? Can you please post the question here on my phone because we can't really read. Wait. Okay, let's change the question. So the question is there a risk for dementia if the hearing loss is one side of the ear only? Dr. Donna?
Okay. Yes, there's possible risk, but remember, probably I just don't know the percentage, okay? But if you have listened to my lecture earlier, when there's one ear problem, at least if there's one ear which is functional, both of the brain is already stimulated. However, of course, there's lesser input. So if there's lesser input, there's lesser neural connection, there's a possible risk of impairment. But at least if one ear is still functional, then at least there will still be a bilateral stimulation of your auditory pathway. So it's still good, but probably there's still a risk, but the percentage I really don't know.
Okay. Miss Linda, your comment regarding this question. Can we, is there a risk if there's the hearing loss on one side ear? One side.
Yes, of course, the brain is doing extra effort, because the brain doesn't receive a complete information. So the patient cannot localize the sounds, especially noise environment. So maybe, I don't know if dementia, I mean, I cannot tell you, Dr. Donna said in a better way, but I can tell you that at least the patient will have a cognitive effort, a more cognitive effort, and with the time can change into a big problem as a dementia or Alzheimer's disease, because the brain is not working in the natural way. Without a hearing loss in one side, the brain is not working in a natural way, definitely.
So it's like saying when you have one good hearing on one side only, it's like you refocus, something like that. And then the brain works harder.
Exactly. And
Okay.
especially in noise, when we are in a noise environment, it's a
Yeah.
big problem for the brain. Because if we have in a quiet space, perfect. But with the noise that normally we do on the street, schools, universities, parties, bar, restaurants, it is very difficult for the brain to identify the sounds when you have a unilateral hearing loss.
Okay. Thank you, Miss Linda. So there's we'll go back to the question. Can you please post the question here? The question from Miss Cherry, or there. Okay. So the question: I started having tinnitus right after giving birth in 2008. In 2012, I started wearing hearing aids. And in 2014, I suffered from transglobal amnesia, and it happened again recently in 2021. MRI showed normal result. Am I at greater risk for having dementia? Miss Dr. Donna?
Okay. So, number one, hearing loss. So, there's already a percentage of relative risk of having dementia. Transglobal amnesia, it's somehow what we call as transient ischemic attack. It's like a stroke, no, but it manifested for a short period of time, but it improved at least within 24 hours. However, it happened again. So risk for dementia, Miss Cherry, there's a risk, but not everyone who has risk will have dementia eventually. So what is more important is to control the risk factors that's causing the stroke. For example, in this part, the hypertension, if you have diabetes, cholesterol problem, you need to control all these things to prevent the brain from having several attacks. Because usually, not exactly the hearing loss, but for example, if you have an MRI and you have a lot of white matter changes, I'll go a little bit scientific, white matter changes in your brain, based on the MRI, it poses a greater risk of one having dementia. And for one who have completed stroke, some will have at least 5 years. In a span of 5 years, will have a risk of dementia. So that's stroke only. For the hearing loss, that's additional relative risk factor. Maybe Miss Linda can add regarding hearing loss.
Yes, I just want to say that, of course, when you feel a tinnitus, it's because something is happening in the hearing. Sometimes the clinician can identify, but sometimes not. But we are sure that something is happening because tinnitus is not a normal symptom if I have a normal hearing. So it's good to check. I mean, but I cannot say that also with this, it can be a risk of dementia. Of course, you need to pay attention, maybe to go to your clinician and check your hearing and check if everything is okay, or maybe you will need to start using a hearing aid depending of the hearing that you have. So tinnitus is a symptom. It's not like a hearing loss. It's not the identification of the hearing loss. It's a symptom for something. So it can be because you have tinnitus because you work in a noisy environment and your ear is tired, or maybe because you are starting to having a hearing loss. So it's good to go into a clinic, check your hearing, see if you need a hearing aid, or you need to maybe one time per year go into a clinic and check every year your hearing. But yeah, this is my recommendation for you. Yeah.
Yes, may I add to that? So, like, Well, tinnitus is also a symptom. Aside from hearing loss, it could go hand in hand with hearing loss, tinnitus and hearing loss. But whenever there's the tinnitus, we need to have a workup for that. So, like what Miss Linda said, the patient should follow up with an ENT, with a neurologist. It's like they work hand in hand, and there should be a follow up MRI also. Okay, so it's already 8:58. I think that's our last question for tonight's live event. This concludes our question and answer session. To our viewers, while we cannot answer the rest of the questions you sent us due to time constraint, our team is actively taking note of it, and we will feature it on our social media in the following days. Once again, we are grateful to have both of you tonight. Manila Hearing Aid will forever remember this live episode where Dr. Donna and Miss Linda shared their knowledge and experience about hearing loss and dementia. We hope our viewers learned a lot from them to have a better and clearer understanding about the relation of the two conditions. Thank you, and until our next episode of Here to Aid. Good night, everyone. Thank you, Miss Linda. Thank you, Dr. Donna.
Thank you also.
Thank you for inviting us.